and welcome to another edition of the New York chapter in our occasional series with our virtual events. Today's event will be benefit from private. Next slide, please. For today, there's live captioning for those that may need it. We also have the Q&A function that'll be available, so all your questions will be there. And we'll be monitoring them during the session, and near the end, as time permits, we'll be able to get to them. If you run into any technical difficulties, both on our website and on chapter. Next slide, please. Can you go to the next slide, please? We'll also implore everybody to be able to join our chapter. You can do it quickly by simply logging on. And so let me introduce our moderator, Mr. Dan Lafredo. Dan from Sienna Corporation, go ahead and take over.
Thank you, Tony. Hello and welcome to today's webinar, Benefits of a Private Optical Network for Hospital Systems. As Anthony said, I'm Daniele Lafredo and I head up solutions development for the healthcare sector at Sienna. So I'm excited to serve as the host for today's panel discussion. And I thank you, the audience, for joining us. I think we're going to have a great session over the next 60 minutes. So during our time together today, we'll talk about how some New York State HIMSS members made their journey to a private network, as well as the value and benefits they've realized from them. So let me define that. By private network and private optical network, we mean either connecting locations throughout the hospital system in either of two ways, either leasing dark fiber and then lighting it up with an optical network switch, or leasing a dedicated optical connectivity service from a service provider. So for those of you who are not familiar with Sienna, we're best known as the leader in networking technology innovation, and we serve a range of customers from telecom service providers to large enterprises, including dozens of hospital systems. Now you can use our network devices in either of those two methods I mentioned before, in dark fiber environment or through a managed service provider providing a private circuit. Now, joining me today are two distinguished panelists, Vincent Pawlowski at Northwell Health and Tony Polacco at Westchester Medical Center. So welcome, Vincent and Tony. We really appreciate you being here today and especially your willingness to share your experiences with your fellow HIMSS members. So to begin with, I'd like to ask each of you to take a few minutes and tell us about yourself. What do you do? What's your title? And talk to us about your hospital systems. So Vincent, maybe let's begin with you.
Okay, great. Thank you, Daniel. So first off, again, Vince Pawlowski. I'm the Vice President of Technology and Infrastructure Services at Northwell Health. I'd like to lead off by just, again, thanking everyone for the opportunity to speak to you today. I greatly appreciate it. Some background on Northwell. Northwell is New York State's largest private employer and healthcare provider with 23 hospitals and more than 830 outpatient facilities. I've been with Northwell now for a little over 8 years. My current responsibilities include the overall operations and support of enterprise infrastructure, which comprises of all compute storage, messaging, endpoint engineering, desktop support, communication services, which is voice, data, video, and cellular communication services, data center operations, service management, which is comprised of the service desk, IT asset management, problem and change management, as well as overall service delivery management for our IT services. Prior to joining Northwell, I was with IBM for over 28 years in various leadership and technical roles. Joining me today is David Cipitelli. David is a director in our communication services organization, and he has been instrumental in the planning and implementation of our managed private optical network.
So you answered that. My next question, Vincent, I was going to say of the two, the dark fiber or the managed, sounds like you go with managed. Vincent, can you tell us how many locations and facilities are involved with Northwell Health?
Well, again, it's the 23 hospitals, and again the 830 plus outpatient facilities. Specific to our private network, that's supporting all of our hospitals, critical business locations, and outpatient facilities, especially those that require high bandwidth needs.
Good, great, and we'll get into some of that in a bit. So great, that sounds like a really big system. So now, Tony, maybe you can tell us a little about yourself and Westchester Medical Center.
Hello, everyone, and thanks again for inviting me to this event and the opportunity to speak. On behalf of my health system, I'm Tony Optical. I am the Senior Director / CTO for WMC Health. So WMC Health is a health system with about 1,700 bed regional healthcare system headquartered here in Valhalla, New York. We have 10 hospitals that spans about 8 campuses. We also have 2 physician practice networks, and we primarily serve the Hudson Valley and the Upper New York region. With that said, we have about over 3,000 attending physicians in our health system. We are a level 1, level 2, and a pediatric trauma center, region's only acute care children's hospital, an academic medical center, several community hospitals, dozens of specialized institutes and centers. We offer skilled nursing services, assisted living facilities, home care services, and one of the largest mental health systems in New York State.
So yeah, sounds like another big hospital system. So also to you, Tony, on that question of what type of private network do you have? Is it dark fiber or a managed service?
So we have a mixed environment here. We have some managed services, optical networking, as well as we are building up our own private optical network based on some strategies that we have in play.
Very good, very good. And we actually had originally had a third speaker lined up, but unfortunately had to cancel out last week. But like yourself, Tony, he also was running sort of a hybrid network, did a lot of dark fiber and then some managed services out to some remote branches, remote clinics. So I can kind of talk from his perspective as well. So with that introduction, let's kind of jump in. So kind of Vincent, following up on your talk about your managed private WAN, can you talk a little bit about what was the state of your connectivity and your WAN before you decided to make this move to a private managed service?
Okay, all right, great. So prior to going with the private optical network for the specific locations that I had referenced earlier, we had a point-to-point kind of a hub and spoke traditional design running on an MPLS backbone. This consisted of 10 gig head ends at each of our strategic data centers, which then was subdivided to allocate the bandwidth to each of the remote locations. And we also had links between the data centers. And the bandwidth allocations were done according to the specific needs and use cases at those particular remote locations. We started to explore other options several years ago to meet the challenges that we were facing at that time, but also anticipated going forward. The ability to scale that solution, was a challenge. There was concerns about our dependency on the local carriers and then the associated cost. And again, thinking, forward thinking to the future, we were anticipating just an explosion of the bandwidth requirements needed, and also the growing concern and need around security and the limitations that our previous architecture afforded us.
So it kind of sounds like 3 key points, right? Scalability, security, and really just cost, right? So they're kind of three big drivers, right? Yes. Tony, how about you? What was the state of your sort of WAN prior to you thinking about this hybrid environment?
So we are fairly new to the private optical networking space. We became a health system, I would say, about in the last 6 or 7 years. Prior to that, we had our WAN networking requirements was to actually access our hosted EHR solution. So we had private circuits that made that available. So through the evolution of our health system, we had a need to bring high availability into our environment. So we redid our data center strategies. Based off that, we have an active stretch cluster architecture that was put in place about 7 to 8 years ago. And based on that and some of the M&A activity that happened within our network, we leveraged a 2 data center architecture that made our infrastructure highly available, and to keep replication traffic under a threshold of certain latency requirements that we had, we procured our first link. It was a 2 redundant 10 gigabit a managed circuit links that we started off with. Then we also had campus requirements where we needed to extend our corporate LAN to a building that was on the opposite side of the highway. So we leveraged dark fiber there. And currently we are undergoing a strategy on consolidating data centers that are spanned throughout our health system. We have about 13 data centers, and we are going to a 2 data center architecture, and that requires connectivity to be very strong. And we are exploring private optical networking for that, and to making our solutions future-proofed. I also want to make sure that when technology evolves, we are able to grow with the technology and making the bandwidth requirements that would come as part of that. We are accounting for all of that, and obviously being cost conscious, making sure that we deliver highly available solutions to our end users.
So guys, like availability, again, future-proof, and then some cost in there, and probably also a little bit about destiny, kind of controlling your own destiny. Some of our other customers, and you mentioned this in terms of mergers and acquisitions. A lot of our customers that have deployed a full dark fiber environment really have gone on the an M&A spree, and they find that they've got all this hodgepodge of different network circuits, and some of them are redundant, and so they've used this dark fiber network to really converge into an enterprise grade network that really provides those things you both talked about, that availability, scalability, future-proof, and the cost. Vincent, let's get back to you. You did mention in one of your points that you want to make sure that you've got the bandwidth now and in the future to support some of the applications that are evolving. Can you kind of talk to us about which applications are more bandwidth intensive or latency sensitive, or whatever that drove the need to move to that private managed network?
Mm-hmm. Yes, certainly imaging, radiology, our PAC systems, also the drive towards mobility and having a much more distributed environment was another key driver. So that those were, key aspects to our requirements. In addition to all of that, it was, as Tony had said, the scalability, the resiliency, the privacy, and of course the security, and the explosion of telehealth, right?
Yeah.
And that went from something that we were only just beginning to adopt and roll out, 18 months ago, to something that we had to unfortunately very rapidly deploy due to the pandemic and the new requirements that were being, thrusted upon us. So, that was another key driver for, having that scalability and reliability and resiliency.
Yeah, you mentioned that imaging. I was at the HIMSS annual conference a few years ago, and I was in one of the sessions, and they had a CIO from a hospital system in Missouri and another one from somewhere else, I can't remember, but the one CIO got up on the stage and he was talking about the same sorts of things we're discussing. And he said one thing that really kind of hit in my mind. He said, never underestimate the impact on your network when you move from a 2D imaging to a 3D imaging. And this was like several years ago. But now what we're seeing in the last year or so, when you're adding on that 3D imaging with artificial intelligence, machine learning to do that AI-enabled diagnosis of those 3D images, then we're really talking about multitudes of bandwidth. How about Tony? Any particular applications that really drove you to this sort of higher scalability and capacity environment?
Yeah, again, touching on what Vincent said, imaging is a big driver there. We have imaging on both the radiology and the cardiology side. Lately, we recently went live with a new digital pathology system. All of these are very bandwidth intensive applications that requires a core infrastructure to be in place to make sure that they are highly available, and the diagnostic quality of those images and how quickly you deliver them to the clinicians were all concerns for us and reasons for moving to an optical networking.
Yeah, I've heard other hospitals are talking about they're deploying these robotic what we'd say like a conveyance capability within the hospital, and they've got these robots running around like delivering stuff to the patients, and even some of them there's a robot with a video screen, and there's some remote nurse or physician visiting the patient bedside via that robot. Are you guys looking at any of those types of applications?
Well, I was beginning to explore that in our innovation center, but besides that, we have, back to telehealth, something that we began to deploy just a couple of years ago that, is now a cornerstone of our patient care is telestroke, where you have these mobile carts that provide very high quality, detailed video of the patient, that allows us to have neurologists, be able to respond to, a care situation, within, minutes, as opposed to having them potentially have to be, called and dispatched to a particular location. And that just has been phenomenal in the ability to provide quality patient care in that particular scenario. And again, that's another driver for, high bandwidth, high quality, video communication at the bedside and at remote locations.
Yeah, and that, I was going to ask you that. So when you talk about that situation, is that, the video application between like, an urban hospital with all the surgeons and specialists and like a remote rural clinic, or is it actually going into the patient's home?
Right now, it's between, as you had said, not only our tertiary hospitals, but also hubs where we have the neurologists centrally located, where they could very rapidly be dispatched, virtually through the telehealth carts to where they're needed. And also when they're remote, essentially when they're either working from home or from any location, they'll be able to respond to and provide the necessary patient care.
How about Tony? How about you? You have robots running around Westchester system, or?
We do not have any robots yet running around, but telehealth has been a key driver for us. And I just want to touch upon how we have stood up an EICU command center that remotely monitors our critical care patients throughout our health system from a command center located here in our Valhalla campus. So that reaches out to all 10 of our hospitals and some of other partner hospitals that have partnered with our telehealth team to monitor their patients from our facilities. So we have bi-directional video to the bedside along with an e-alert button that the patient or a clinician can hit that alerts the command center and react upon to it, so that we provide better nursing and clinician availability to our critical care patients.
That reminds me, Tony, one of our other customers down in the Florida area, they have something similar. They deployed it a couple of years ago, and they noticed that their emergency room mortality rates were very high, and so they upgraded their private network to 10 gig plus, and with some of that bandwidth, they put in an application that was a video-enabled remote emergency room monitoring capability, where the emergency room patients would go up every 15 to 20 minutes and talk to a physician that was in some remote area. And if that physician determined that they needed to prioritize those emergency room patients, they would notify the nurses or the emergency room technicians, who would go and grab that patient and bring them into the diagnosis and treatment center. And they said by doing that over the course of a year and a half, they were able to reduce emergency room mortality rates by about 40%. Now, are you guys kind of putting some of those metrics behind any of the technology you're deploying? Maybe Vincent?
Yes, similar to what Tony described. We have also a very mature now EICU, and that, be quite honest with you, I don't have the metrics offhand, but that has significantly improved patient care and patient outcomes as a result of that. Again, the rapid response, the constant monitoring, a level of support that really just would not be available without the implementation of that technology.
Good. Same thing with you, Tony. Are you surprising some of the CMOs and others that are saying, hey, this is what you can do with technology?
Yeah, definitely. It's exciting times that we are able to offer these solutions out to the clinicians and improve quality of healthcare. So definitely there are metrics in play here that's being monitored by our performance management teams. I am not part of that team, but we provide the core infrastructure and technology directions for my company.
Got it. Well, I've got you here, Tony. Let's kind of think about a question that a lot of audience members are wondering about, especially because you're thinking about a dark fiber as well. What's the scariest part, about moving away from, having like, 2 or 3 different service providers and kind of moving to one provider, whether it's your managed services that Vincent has, or with their sort of dark fiber and combination. What's sort of the what gives you the most hesitation about moving down that path?
I guess the primary concern that I always had was not having a managed service provider handling what if something goes wrong with my optical network, right? Like who am I going to reach out to help remediate any issues that came up, and in a very timely fashion. So that's where whenever we deploy dark fiber, we always look at diverse paths. making sure that they come into our campus through two separate buildings. And finally, making sure that we have some SLAs in place with a vendor that's able to react to an event where, in case there is an outage on one of the strands that we have, and how to revive that, and making sure that we stay highly available.
Yeah, that's a good point. What we hear a lot is, if I deploy this dark fiber network, do I have the staff to really manage a network? We're not a telco. And I'm kind of saying, well, there's with software, managing a network is not like what it used to be. So with software, you're able to do a lot of automation. And then, there's also, if you want to outsource, operation of your NOC, there's that capability. Let's turn to Vincent, because you went the managed private perspective. What were some of the, kind of, obstacles or, scary parts that you felt about moving towards like a single vendor provided capability?
Okay. Well, fortunately, that's why I have David. He had to deal with that. But joking aside, as I said earlier, he was instrumental in the planning and execution of our implementation. So, David, if you could maybe share, some of, the challenges that we faced, but more importantly, what we did to mitigate that and address it. Because again, we wrapped up our implementation just this earlier this year. It wasn't without its, bumps, as anyone I think would expect. But overall, it was a resounding success. And again, that was due to in no small part to David and his team in properly, planning and executing.
Yeah, thanks, Vincent, and greetings, everybody. Good afternoon. It's a pleasure speaking with you. Yeah, like Vince said, there's lots of challenges and things to plan for. I mean, really, if there are some key takeaways or key pitfalls, you must absolutely build in plenty time, extra time into your project plans. You will encounter time slippage for things that are beyond your control. We ran into issues that you just don't anticipate going into it. They're everything from local site issues for power, HVAC things resulting from requirements from hardware needs. There were also some challenges related to outside and inside plant designs. We had some challenges with landlords, licensing for manhole access, things of that nature. Certainly, it's always a little scary and risky. Change is always a difficult thing to bring in. There are many challenges and risks associated with migrating a large hospital or large facility. Do as much early planning, validate and develop your test plans, fail over validation. You got to ensure that you have full functionality before doing cutovers. There are a lot of common themes, but really planning is a big component of that, and obviously selecting the right partner that has tons of experience in doing this already, because really that's invaluable. Your partnership and your alignment with your partner really doesn't guarantee success, but it certainly increases it by many folds.
Thanks, David. A kind of clarifying question. I know Vincent talked earlier about the previous configuration was sort of like all the different sites connected via MPLS, maybe a mesh type of configuration. In this new environment, what does that look like? How is each location connecting to content and the applications that we talked about before? Are they going to your private data center? Are they going out to the cloud directly, or what's that look like?
So we have multiple data centers. So we built a ring topology, and we have a north, south, east, west path in each direction to all the sites. Each site has multiple points of entry. with direct and diverse paths back to each data center. So there's multiple levels of resiliency. And then the data centers themselves are reinforced by 100 gigabit connection, as well as direct on ramps to our cloud providers. So we have a hybrid environment like many large systems out there, and the optical network just allows us to have the greatest amount of flexibility, and it gives us control of our own destiny. We have the ability and the flexibility to select and choose the appropriate paths.
Yeah, it calls to mind another thing that I heard from another customer, with having a 100 gig a ring, saying that it gives them the ability to quickly reallocate excess capacity where needed, right? So if they got like a big accident that has a lot of patients come in, or multiple fatality where it's overloading a couple of hospitals, they're able to reallocate very quickly bandwidth to support that. Whereas in sort of the old environment where you were kind of dependent upon different service providers, that agility was not there. So yeah, that makes sense.
Yeah,
Tony,
we didn't talk about that earlier, right? The privacy that this network provides us, right? Because this is all 100% dedicated infrastructure for our facilities, right? We're not passing over. It's really secure. We're not passing over public cloud infrastructure. We're in control of our own maintenance windows and things like that, right? And those are they're hard to quantify, but they're certainly very, very valuable.
Yep, definitely. Tony, let's go to you. You mentioned before you look about some of the applications you're putting in, a lot of the 3D imaging and that sort of thing, and you say, hey, I'll scale my network capacity for that. But we also know that hospitals, even though they're open 24 hours a day, they have a peak period between maybe like 8, 9 o'clock and 5 or 6 o'clock. So how did you go about determining what sort of size of capacity you get to ensure that you've got enough capacity there to hit peak times, but you don't want a lot of excess capacity not being used in evenings and weekends? How did you start to determine that? Because I know that's a big question that people ask when they're looking at a dark fiber type of network.
Yeah, so we had an assessment done on capacity planning, making sure that we are properly sized, not oversized or undersized, based on the bandwidth requirements that we have. We also relied heavily on some of the infrastructure components that required certain latency and bandwidth requirements, especially on storage replication side, the active-active stretch cluster architecture that we have implemented here at WMC Health. So those were all determining factors on how we plan for capacity, and we are obviously always looking to improve. So how to cost consciously make sure that we are able to deliver solutions to our end users with no latency, and we are nearly 100% virtual desktop infrastructure here as far as clinical desktops go. All of those played a crucial role in determining the capacity requirements for us.
Got it. Here's another question, Vincent and David. As you kind of move towards this new environment, this dedicated, private environment, did it make it easier to manage the network or more difficult?
I'll let David expand upon it further, but again, as he alluded to, and as we started off the discussion, the path that we took was really what we considered the best of both worlds, right? We had a dedicated environment that we were able to control to an extent that just was not possible, previously. But at the same time, I still had a single throat to choke if there's issues. So with that, I'll see if David has any further comments.
Yeah, with regards to the day-to-day management, because we did end up going with a fully managed solution, It was, challenging at first because it was something new, but in the long run, it made sense for us because it did relieve us of the day-to-day, to a certain aspect of the day-to-day management, because a lot of that was on our provider, and it still is on our provider. It's part of they manage the entire network, and the responsibility for the diversity and the availability. And that doesn't mean that we don't have the expertise in-house. We certainly do. But a lot of the day-to-day stuff is all rolled into our turnkey solution.
Okay, and you have visibility into that network traffic and all that?
We do. We have the monitoring and everything in place.
Okay, good.
Yeah.
Let's see, I think we might have lost Tony. Are you still with us, sir, Tony? Yeah, I think he might have. He might join us here in a bit. I'll kind of talk from our other customers' perspective. One of the things they told us in moving towards the a dark fiber network is that it's really important to ensure that you select the right type of network devices, obviously, to light that up. But more importantly, what kind of software is available that gives you visibility, into the end-to-end network, and be able to see what traffic is going over, what applications are going over, and how much each of those applications are, how much bandwidth they're taking up. I think we are coming up. I want to keep this to our 45 minutes. Let's go to kind of a key question that everyone is wondering, because I think everyone is at a different point in their pathway. Given that what you know today, what you went through, would you do this again the same way? Would you do something differently? What do you think, Vincent?
Well, we would definitely do it again. I mean, again, it wasn't without its challenges. It did represent a significant investment, but we're reaping the benefits that we highlighted earlier. Our ability to have greater control and autonomy over the network, but at the same time still getting the scalability, the level of security we have today, and the ability to increase that in the future is significant, and the levels of resiliency and redundancy that we just didn't have before. So was it worth it? Yes. Would we do it again? Yes. As far as anything different or lessons learned, I don't know, David, if there's anything that jumps out at you as something that was a surprise. I mean, I know you covered some of the challenges. I don't know if there was anything above and beyond that maybe we would have done a little bit differently.
No, I mean, I other than just overplan, which is a common theme. No, I don't think so. I think, Vince, I think you covered it well. I think we had an extremely successful outcome, and we achieved our objectives for sure, while in fact even lowering our costs in certain areas as well. So yeah, it's certainly in my mind perceived as a very successful implementation, and certainly we're reaping benefits from it. And we're at the very early stages, early phases of this, but I certainly see that continuing on for quite a while.
Well, one further question on that, you mentioned it before, the pre-planning was key. Couple of questions, like how far in advance did you start the planning process before you went there, and then how did you engage other like functional unit heads, like your radiology, nursing, etc., and involve them in that planning?
Yeah, we started years in advance, and then we had a little thing in the middle called COVID. That certainly complicated things many times. So yeah, it was a journey for sure. Even just the process of selecting the appropriate partner. But yeah, when you embark in this, I mean, it's an enterprise-wide project. So we engaged everybody from IT, but as well as from the corporate procurement side, from the site sides as well, because obviously you have to get their buy-ins and approvals, to engage the correct folks from site facilities, from even also from a change windows perspective, to get approvals for change windows and testing. So yeah, it is it's pervasive through the entire organization. So you have to coordinate with everybody.
And as you mentioned before, if you're a retail store, you can deal with a few hours of disruption, at the branch. At a hospital, you can't, right? So how did you make sure that you didn't disrupt operations?
A lot of it had to do with the design. So we kept our existing environment active 100% the whole time, while we brought up the new environment, which is challenging from a technical perspective, challenging from a financial perspective, but you don't have the option in healthcare, right? It has to be 100% available. So really, it's all down to really careful and thoughtful technical planning on how to do it. So we had all the networks up at the same time, and then we did selective migrations, and used the technology and the capabilities within technology to do the transition seamless to the networks. Obviously, everything is tested up front to make sure. So really, when it comes down to the migration itself, it's basically a non-event. You're doing all the upfront planning and testing, and then the migration itself, God willing, everything goes according to plan. It's actually anticlimactic. It just goes, it goes smoothly.
And I think
and seamlessly.
Yeah, you answered one of the questions that are coming in. We'll kind of go to the Q&A stage now. That first question was all about that. Did you maintain kind of like both networks up, until you were ready to make that cut, right? So it sounds like that's you kept both of them up running until you were ready to make that cut over.
That's right. You basically keep all the networks up, and then it's just a matter of changing weighting values, and then the routing protocols, take over.
Got it. Another question, and we don't need to get into specific numbers, but one question is, did you see a cost reduction moving into your sort of private dedicated environment versus what you had before? And is there if you can't get into the numbers, is there a percentage decrease, or did it increase? That's one of the questions. Vincent, maybe you want to take that?
Yeah, so I mean, obviously it was an increase, because at the same time of implementing the new environment, it wasn't like for like, right? We were actually going from hospitals having 1 or 2 1 gig circuits, where at a minimum they were going in with 10 gig. So just because of that, there was an increase in cost. But if you looked at it from like a per unit cost, on average, it was costing us less.
Yes.
But our total cost did increase. But with that, right, came all that value add of the greater capacity and bandwidth, the resiliency, the redundancy, the security, our ownership and control of the network. Some of which, it's as David was saying earlier, difficult to quantify. But all of that factored into the decision we made when we decided to go in this direction.
Sure. Yeah. Our customers that went for the full dark fiber, for them it was a initial increase in capex, and then a reduction in opex. So I think the depending upon the system and what's they've got going, they did have a spike in the capex for that particular year, but then they decreased the opex by about 25K per year, and this is going a couple years ago. So there's always that trade-off. I think we got time for one final question. you know, as you moved into your environment, did that, did that help your security posture any, or did it make a difference in security?
Well, since, as you know, security is, right, it's difficult.
Yeah.
I think certainly our current posture has been improved. Our ability to affect that, positively in the future is also there, that additional capabilities. Knock on wood, it's we haven't had an incident that that we would be able to comment on. But certainly our CISO is currently happy with the health and cyber hygiene of our infrastructure, and in particular our network. But as we know right now, that landscape is very dicey right now. Things change. Not even on a daily basis, almost on an hourly basis.
I know. Yeah. Some of our customers in dark fiber, they encrypt at that optical layer, and that gives them some peace of mind. But again, no one strategy you take is going to be forever and take care of everything. It's just one foundational piece of a multi-tier strategic security program. Anthony, I think we're about at time. I'll turn it over to you for any closing remarks. Oh, I think Tony froze.
David and Tony. Can you hear me okay, guys?
Yeah, cutting in and out, but.
Tony, turn off your video.
Yeah, I apologize for any inconvenience here. There's a big storm coming through, which is probably affecting all of the internet capabilities. But I would like to thank Daniel for a great job in moderating this panel of Tony, Vincent, and David. Excellent job, and we appreciate you folks coming out and helping our chapter and keeping us in tune with making sure that all of our members can get some great information out there. For those of us that are going to be attending next month, the HIMSS National Conference in Vegas, bring sunscreen, okay? It will be hot and it will be sunny. For those that are going to be attending online, enjoy that in the comfort of your air-conditioned home. And our next event will be held on the 24th of August, where we'll be having Helen Ozeslowski talk about the new CARES Act and what has happened since the April 5th deadline. Should be very interesting conversation. And then look forward to all of our events coming up in the following months. We have quite a plethora of great speakers that we're trying to continue to keep adding to our events. Come and join our chapter. We're always looking for people to join some of our committees. And I would like one more time to thank Sienna Corp for helping to sponsor this event. It was a pleasure to have all you gentlemen on today. And to our producer, thank you for doing a great job.
Thanks, everyone.
Thanks, everyone.
Thank you.
Thank you.
Okay, we'll go off live, Nick.